Hi, I'm Helen from HypnoFit. My passion is to help people overcome adversities, overcome challenges, and live life to their ultimate potential. One lady who is a brilliant example of overcoming adversity in her life is Harvey. She is an absolutely amazing woman, and I am speaking with her today because I want her to share her incredible story with you. On the 24th of January 2013, Kerryn went to South Australia to participate in an event. She was accidentally and tragically thrown off her bike. She contracted a disease called necrotizing fasciitis, which is a flesh-eating bacteria. As a result of that, her shoulder and her arm were both amputated. This is her incredible and remarkable story. Kerryn, thank you so much for coming.
Thank you.
So, you've got an amazing story to tell the world, really. And what I would really like to know is just right back to the beginning, before January 2013.
Yep.
Can you just give me a snapshot of what your life was like back then?
Yes, so my life prior to January 13 was very active and full. Loving life, actually. I was participating in a lot of triathlons, doing a lot of fun runs, so keeping myself very fit and active, and really enjoying that. Work-wise, I worked full-time for a non-emergency patient transport company, so I did work for Ambulance Victoria, just transporting low acuity patients.
Oh, yeah.
Really was enjoying that. It was pretty stress-free, it was a good life. Shift work, which gave me plenty of time to train, and did a lot of travelling as well, especially active holidays, like cycle holidays. So yeah, life was good.
So it was like being active was a massive part of your life. How did that start? Was it in your childhood? Were your parents, did they encourage that? How did it all begin for you?
It probably did begin in my childhood. A little athletics under fives, I think it started at.
Yeah.
And I had two older brothers. We're all into sport, all into different sports throughout as kids and as teenagers, and then probably went off the rails a bit in early 20s and then back into it again. And my parents were very active as well. They played tennis and golf and varying other things. So yeah, always active, so I was lucky. Okay,
so in terms of doing some sort of exercise, it was multiple times a day, every day? What kind of regime did you have?
I suppose in the last few years prior to my accident, triathlon was my main focus.
Okay.
So I'd often train twice a day. Not every day. I was pretty good at having recovery days as well. But because it's three disciplines, you get swim, ride and run, you do need to put a bit of time into all those, and there's only 7 days in a week. You like to do each of those disciplines, 2 or 3 times a week. So yeah, often it'd be twice a day, especially I trained for a lot of endurance triathlons, so it was very time consuming.
Yeah.
But good fun as well.
Yeah, so in terms of triathlons, I mean, that's the ultimate for sport, isn't it? So in terms of your fitness level, it would be right at the very highest level, wouldn't it? In terms of a population, if we're looking at the population as a whole, it would be right up there, right at the top. Yeah,
if you compared my fitness to the general population, I'd definitely be in the top few percent, I would think.
Okay.
Not elite, but just definitely the effort I put in would have put me in the top percentages.
Okay, wonderful. Yep. So if you can just talk me through, exactly what happened on that day in January 2013, right from the beginning, before the event even started, right from the beginning.
Yep. Okay. So I was went over to Adelaide to watch the Tour Down Under cycle race with my partner and a friend. And the way you follow the race is you take your own bikes over and you can just ride around the course, and as the riders come through you just get off and watch the race go through, and then you can jump back on and ride recreationally between all the towns up in the hills. And it's just a fantastic way to see it and get up and close and personal with all the pros, and it's just a really good week away, which includes lots of cycling but also lots of socialising.
Yeah.
So I think it was about day 3, and I'm a bit blurry as to what exact day it was. It was about day 3 we were there, and the race had finished for the day. We were up in the hills, and we're all riding back into the city with thousands of other recreational cyclists. Just heading back down into Adelaide, and I got knocked off my bike by another cyclist who just cut me off, came down to my right, cut in front of me, and for some reason he wanted to be on my left, and I had nowhere to go. I hit his back wheel and came off pretty hard. I don't know if I had how many somersaults I would have done, I don't know, but I came down really hard. I had to get an ambulance in to take me off to the Royal Adelaide Hospital. So when I got there, they checked me over and cleaned me up. I had lots of scrapes and scratches, and I needed stitches in my elbow. I developed a huge hematoma on my hip. I must have come down very hard on my hip. So they kept me in overnight for observation, mostly for my hip, because it had swollen up so much. And then the next morning they let me out. I went back to the Hilton where I was staying and just got told to rest, and I was on some painkillers. So I rested up for most of that day, but my elbow was getting really, really sore. I was really, really uncomfortable. I thought, I was sure I'd busted it, but they'd already x-rayed and said nothing was broken. Anyway, I asked my friends to take me back in too, because I just was really uncomfortable, and so we called a cab back in and re-x-rayed it, still couldn't find any breaks, gave me some more painkillers, even better ones, and back to the hotel, pretty much went to bed after that, and then I woke up that night, it must have been about midnight-ish, and my arm just felt, I could hardly feel my arm because it's kind of hard to describe. It felt like you'd been sleeping on it wrong, and it's all tingly, but I couldn't move it, but it also had extreme pain in there as well.
Yeah.
So I turned on the light, and I just couldn't believe what I could see. My arm was so swollen, it was just, it was amazing. It was probably twice its normal size, and I had all these blisters just growing on my arm, and I could see them growing as I was watching it. So I woke up my partner, and we sort of we had to work out what we wanted to do. I knew I needed to go back to hospital, so we ended up bringing an ambulance, and they came and took me back to Royal Adelaide Hospital.
How did you feel at this point? Were you frightened,
terrified? I was
terrified?
Scared out of my mind, yeah, because I felt in myself that I was really unwell. My heart rate was just flying, and I just felt really weak, and in fact, before the ambulance got there, I started to pass out. I was sort of in and out of consciousness a bit, because I was getting quite distraught as well. Anyway, so the ambulance took me into the hospital, and I actually don't remember anything from this point on. So this is really just what other people have told me. In emergency, they recognised pretty quickly that I had some sort of flesh-eating bacteria. So they brought all the main surgeons in, and I went straight into surgery pretty much within an hour to try and remove all the infected tissue. And out of that surgery, I went into intensive care. I still had my arm at this stage. They tried to save that initially, but unfortunately they couldn't control the bleeding at that point. So, and the infection was still there, they found. So then early on the next morning, I was taken back into surgery to try and control the bleeding, and they realised the infection was advancing still, so the only option was to take the arm. They also took my shoulder, all the muscles down my back and across my chest. So
this time you were completely out. You didn't know that any of this was happening.
Didn't know any of this had happened. Nothing. I didn't know. No. My life was in grave danger at that point. They did think I was going to bleed out.
Did anybody get called from your family to come in or anything?
Yeah, well, it was a Friday night. It was a long weekend, Australia Day weekend. All my family were away in different parts of the state, and my partner was with me, fortunately, and my close friend was with us. So they were trying to ring people, and they couldn't get onto anybody.
Okay.
So when the surgeons came out during the second op and said, we have to take her arm or she's going to lose her life, what will she think about that? They had to decide that had agree to that.
So they had to agree to that. The surgeons couldn't just decide that this
it was like you've got two options basically. We take her arm and probably some other bits and pieces, and hopefully she'll survive, or she doesn't survive.
Yeah.
So I think they made a good decision, personally.
Yes, for sure.
So then once I came out of that surgery, that my partner and we were able to get in touch then with the rest of my family and some of our close friends, and they all came back from wherever they were in Victoria, somewhere in the city, but and pretty much are all on flights within the next few hours over to Adelaide. So by that afternoon, I think there was about 20 people who'd flown in, which was pretty amazing.
Yeah.
I'm still obviously out of it, have no clue what's going on. There was more surgery that day as well, they kept on wanting to go back in and recheck how things were and make sure they got all the bacteria. They still weren't 100% sure. So that I was in intensive care for the next 3 weeks, but the first week I was on life support, so basically my organs had all shut down, so I couldn't breathe, I couldn't, my kidneys had stopped functioning, I just had a bunch of machines keeping me alive, and then after a week, I probably had 4 or 5 operations within that first week, just effectively on going and rechecking, taking more dead skin and more dead tissue, making sure they got it all, and then they were quite confident they had got it all by that point. And I was sort of at a point where I was stable enough to wake up, so they woke me up. And then the next 2 weeks I was still in intensive care, and it was all very blurry.
What was the first thing that, when you woke up, what's the first thing you noticed, Kerryn?
Well, it's funny, I kind of knew I was in hospital. I think even when you're unconscious, you have different levels of consciousness, and there's like snippets of conversations that I could recall. So I kind of knew, that I'd been in a life-threatening situation, but it took me weeks to piece it all together as to what had happened, and it's like joining the dots. Like I'd have a snippet of information there, and a snippet of information over there, and a snippet of information over there, but I couldn't put them all together. And people were telling me things, but I didn't remember. So 5 minutes later, I'd be asking the same questions again, not realise. And I had more surgeries as well during that period. And I remember one particular time I was going into a surgery. It must have been a couple of days after I woke up, and I was saying to Renee, my partner, I said, I don't care what they have to do. They can take my arm, take my arm, if it's going to make me live. Not realising that I'd lost my arm a week ago.
So you didn't know at that stage?
Well, they told me, but I just kept forgetting.
Okay.
Yeah, because you're on so many drugs that you
so
really can't feel.
There was no shock because there was no real comprehension at that point?
No, that's right, yeah. Which is probably easier in some way because you kind of ease into it. It's just a slow realisation over time of what's happened to you.
Yeah.
The biggest shock to me was knowing that I hadn't been awake for over a week, and every time I woke up I'd see a different face and just thinking, what are you doing here? And every time I woke up I was you're here.
Total time distortion.
It was total time distortion. No clue how much time
you would think that a minute went past, and in fact a whole day could have gone past.
Yeah, absolutely. Yeah. So it was just a really weird place to be in. Yeah.
Was there any kind of fear at that point, or
not at that point?
No emotions at that point?
No emotions at that point, apart from the emotion at that point. When the emotion started kicking in, it was more about as I was realising how close to losing my life I was and what everyone had gone through. Yeah. Not about losing my arm, it was about all these people had been sitting by my bedside for a week or more, like keeping this bedside vigil, not knowing if I was going to live, and then waking up and going, I should have been there for you. And that's what it was like. I wasn't part of that, and they were also upset. And it was just weird because I wasn't part of that. I was the one that missed it. Yeah. So that was my first. I still get a bit emotional about it, but that was my first real feeling of emotion. Yeah. To know that all those people cared for you and loved you and were worried about you and concerned about you, and you were concerned about them rather than about yourself. Yeah, because they're all there, everyone's crying, because I'm crying, but it was more like I was crying for them because I was thinking, you poor guys, I can't imagine what it was like to get that phone call to say, Yeah, so at this point you still weren't really comprehending that something major had happened to you. I was kind of comprehending that I was very, very ill, but I wasn't really comprehending about that I was going to have a permanent disability. Okay. Yeah, not at that point. Yeah. Okay, so then what happened? So I spent the next couple of weeks in intensive care, and that's when I slowly started pulling things together and working out exactly the story. That was really tough in there. I had, I was on tubes everywhere. I had a feeding tube. I was on dialysis because my kidneys would not kick back in. So I went onto a dialysis machine. Initially I was on that 24 hours a day. I basically couldn't do anything for myself. I couldn't move. I could barely lift my arm. I was swollen. I was so full of fluid because my kidneys weren't functioning, so there was no excretion of any fluids. So it was all, they were trying to get out through the dialysis machines.
Were you in pain? Was there pain or not?
I wouldn't say pain, no. I couldn't really feel much of my body at all at that point. I could kind of lift my legs a bit and lift the arms a little bit, but I couldn't really do anything for myself. When you're in intensive care, you just lie there, really, because that's why you're there.
Yeah.
You're so sick you can't actually do anything.